Welcome to An Hour to Give. I'm Sam Laprade. Today we're going to be talking about the Ottawa Hospital. There's so many exciting things happening at the Ottawa Hospital. Of course, if you haven't visited creatingtomorrow.ca, you'll want to head there for sure. It's my pleasure to introduce our two guests today, Dr. David Grimes and Andrew Frank. Hello to you both.
Hello, Sam.
It's great to have you here. Dr. Grimes, tell me what you do at the Ottawa Hospital.
So I am a movement disorder neurologist and the director of the Parkinson Clinic and a clinical researcher at the hospital.
So before we go any farther, tell us what Parkinson's is.
So Parkinson's is a brain condition where there are very specific groups of cells that are basically dying faster than they should. And so it creates lots of different problems for people, both sort of shaking that everyone tends to see, but also slowness of movement. Can also, though, have trouble with balance later on and start to have, for some people, cognitive troubles as the disease advances. So it can cause a lot of different problems for people.
Yeah, interesting. And we often think about Michael J. Fox, right?
Yep.
Because he sort of came out and was very public about his struggles.
Yeah, he's been an amazing figure for Parkinson research. So he funds the most Parkinson research privately in the world.
And there's amazing people in this city that also support Parkinson's. And Andrew, how are you today?
I'm fine, thank you, Sam. How are you?
Good. Tell me your connection to this discussion we're having today.
Yeah, my connection is my mom was diagnosed with Parkinson's in 2002, back in Toronto. But meanwhile, in 2002, my wife Lori and I and two of our kids at that point moved to Ottawa. And over that time, as my mom's health started to decline a bit, I was far enough away from my mom that I wanted to do something, and so we got connected with the Ottawa Hospital through the Ottawa Hospital Foundation, and we started raising some money for the fine doctors, Dr. Grimes and his team here in Ottawa.
Tell me about Piper.
Piper. So Piper stands for Partners Investing in Parkinson's Research, and it's a group of people who kind of came together in a way of just talking about, we all had someone in our family who was affected by Parkinson's. It turned out the three core people were in the same office at an RBC Dominion Securities office here downtown in Ottawa. Richard Shantz and Bobby Driscoll were the other two people. And so we were just chatting and we said we'd like to do something. And I knew a couple other people in the city, Ian Toth and Rob Carr, whose parents, one of each parents was been affected. So we just started talking, and I must say I give Richard full credit and said, well, we got to do something. And he brought us together and brought in Susan Doyle from the Ottawa Hospital Foundation many years ago. And she educated us about ways to raise money and how to work with the Hospital Foundation, which I must say, and I can go on this for a while, it was one of the most important things we ever did because the foundation was so important to helping, 5, 6, it grew to a number more, but we had no idea what we were doing. And so the foundation, that's what they do. They raise money. And they provided the idea of using Race Weekend. And that was such a brilliant idea because we have people with Parkinson's and they mobile challenge. So there's a 2K walk, that's kind of the core thing, but family members all want to let's challenge ourselves. And so you got the 5K run, the 10K run, the half, the full. So it gave the opportunity for everyone to participate at the level they wanted to or could. And at the same time, they had this wonderful platform called Run for a Reason, and that became a perfect platform for us with a system to send out to friends and family and begin the process of raising money. And in a way, we had no idea what we were doing, and we had a goal, and we didn't know what to do, and the foundation was fantastic. Most important partner we brought in, other than, of course, the doctors.
Yes.
Because I do want to sell that, because I must say one of the great things was the foundation, but then the doctors showed up.
Right.
And what an engaged, amazing group of people, because it's, there's really so many parts that help you get motivated to raise money, and it's obviously the people who are sick, but when you have doctors who are so engaged with their patients, it just increases your desire to support, and we have a wonderful group here led by Dr. Grimes and some others. So.
Now, Dr. Grimes, I'm listening to Andrew and I'm thinking, this is a doctor's dream. That you have people not only that have people that are affected, so their loved ones, they're seeing the struggles, but they want to do something. Not only do they think about doing something, they do something for a really long time. So is it a dream for you?
Oh, absolutely. I mean, it's been a wonderful, collaboration, and it really has been key for us to really push Parkinson research in the whole region, improving not only care for patients, but also the newest, greatest things that are happening in Parkinson research. So it's really been a wonderful relationship, and it's nice to see the patients and their families kind of outside the clinic environment as well.
Mm-hmm. And I always think research today, treatment tomorrow, right? So it's such an important aspect, of course, and the Ottawa Hospital is world class in terms of research. Did that surprise you that that was in this city of 1 million people, that we had this type of talent here?
Well, I think it made us super happy. I think it was obviously I'm not sure we were surprised, because we know we have we got wonderful universities here, and we knew we had a good hospital. So I think, and Dr. Kitts at the time was there, so it was a really good leadership between Susan Doyle and Dr. Kitts, and then eventually Sharon Martin came involved with us. But I think getting to know the doctors, because there's one thing to have amazing doctors, it's other ones to find doctors who are so engaged and willing to commit their time and support us, and to watch it grow. And I think, the name Partners Investing in Parkinson's Research was quite strategic, and I must give Janet Shantz she came up with the name. She had Parkinson's herself. And the investing part is, we always wanted to find research, and we think about research as finding a cure. And that's a complicated and long-term process. We still remain committed there. But we also learned, as we started to live with Parkinson's, that we also wanted people to live better with Parkinson's. And that's become a big part of the process. It's one thing to get clinical research to find the cure, the genes, why the cells are dying, but how do we help people move better and educate them? And I think that's been one of the interesting, over 16 years, watching as our patients and families aged, we went from research, find the cure, to we got to live with it well as well. Mm-hmm. So that was a really interesting process.
Mm-hmm. And the impact of Piper, the impact of this initial conversation and what's transpired over so many years, I understand that the Tamarack Race Weekend, of course, is coming up very quickly, and we'll talk more about it. But potentially you're going to have 2 million reasons to smile. Yeah. So the impact of those dollars, walk us through where did the money go? How was it used to have people live better with Parkinson's?
Great. So as Andrew mentioned, I mean, it has been an evolving part of what we do, and certainly, early in my career, I was in the lab myself doing molecular genetic work, and my career has evolved. But our initial funding was really just for basic science. It was really we really focused on the cure. I mean, we continue to fund students in the lab, both PhD students, master's students, and so we're still focused on that. But now we've broadened our sort of what we're trying to do, and we now have research programs to try to come up with better ways to deliver healthcare. And so we all know that we're challenged with our healthcare dollars, and so how do we help patients help themselves more? And so we've come up with this integrated Parkinson's care network model of delivering care, and that really is really being the initial seed idea is being funded through the Piper work. And so we're really, again, expanding our focus of what we're trying to do to help patients, as Andrew said now.
It's amazing. Tamarack Race Weekend right around the corner. People lacing up. They're training for the big weekend. Tell me what that weekend's going to look like for you.
Well, it's a wonderful weekend for a number of different reasons. One, lots of family and friends come in from out of town, and we all meet initially for the 2K walk. And this, again, is all the doctors and the family come together. Over the years, we all have red shirts that say Pound the Pavement for Parkinson's, and that's actually tying in another fundraising effort with Shelby Hayter that we brought together many years ago. And so we will all meet, we'll do the 2K, we'll take a picture, and some family members will then run off and do the 5K, and some will do the 10K that day. So the Saturday is really quite busy. Some do them all, and that's a little bit of an interesting challenge. Yeah. And then we often host events at our houses, and then on the next day is probably equally, or maybe even more important, is we organize a water station for the half marathon and the full marathon. And that's an unbelievable time, because if you want to see inspiration, here we have 150 people in red Parkinson shirts, and we're handing out water, but you have the wave, and it starts off with the trickle with the professional runners. And then it's just wall of people coming through, and they're all doing the half, and then they mix in with the full. And certain times, I know certain members of family members have always taken part in the full difficult races. And here you're inspired to watch these people. We're handing them water. They're so thankful for the Parkinson's people gathering together. But again, the doctors are there, their families, the clinicians, the medicals, the students who are participating. So we've got to know all these people over all these years. We're always together, and it becomes, again, a big family. And then by the end of that, you're exhausted. And it's Sunday afternoon, and you all go back home and probably have a beer and put your feet up. And
if I was doing the marathon, you'd be there till June waiting to give me my water. But anyway, that's fantastic. I mean, is it an emotional weekend for you?
It is. I mean, as Andrew mentioned, it really is a family event. I mean, my mother would come. She's passed away now, but she would come. My in-laws said would come. My children have been going since they were teensy, and when you're standing there handing out the water, there often is potentially 4 generations of people from a family. The 3-year-old handing out the water to the grandparent handing out the water. And it really is an amazing event. And again, the runners are so appreciative of seeing this wave of red shirts coming by, and it really is a really nice event.
We're going to come back because we've got more to talk about. We're going to come back with Dr. David Grimes and Andrew Frank here on An Hour to Give. I'm Sam Laprade. Today's all about the Ottawa Hospital. Come on back. It's great. You guys were great. And we're back on An Hour to Give. I'm Sam Laprade, talking today all about the Ottawa Hospital, creatingtomorrow.ca. You'll want to head there. There's always some great information there about this wonderful campaign to raise $500 million in this community. They are getting there. They are over $350 million in, but there's a spot for everyone in this campaign. And it's so exciting to learn today more about Parkinson's research. And of course, Dr. David Grimes is here, and he's brought his new friend for a long time, I think, Andrew Frank with him today, talking all about the work that's been done through Piper as well. You know, when you think about all of the work that's being done in this community to raise money, it must inspire you as a doctor to know that the young people that are coming after you and what's going to happen with Parkinson's research with all of the money that's been invested.
Yeah, I mean, I think that's a good point. As I mentioned earlier, that we fund both master's students and PhD students, and we've already had kind of the next generation. So some of the early recipients of the Piper Awards have gone off to other places, some of them down into the States, and we've been able to recruit them back now as scientists.
Yes.
And so we're into that next phase of bringing basic researchers back. The funds have been able us to recruit new clinician researchers, and so we've been able to recruit another couple of Parkinson researchers here to the city, from all over the world. One based originally in Austria, and another one from Portugal, and so we've been expanding the team. So that's what this kind of seed money does for us.
And just the reputation of being world class, and of course what's coming with the new campus of the Civic Campus, it's fantastic. It's wonderful. And
I'm going to just jump in just because I think from our perspective as people who are raising money, what we've learned, and it's so important in our medical system, is that there's lots of funds available, but it's a little bit like money will go where there's seed money to grow, and that's we keep going back to investing. And when donors, I guess as well, foundations or other sources of capital see that there's local support, ground support for some of the work that's being done, they have a greater ability as a group to, when they're doing their grants and applying for these, they have the ability to say, listen, we're partially funded. And that is what a lot of grants want to hear. They just don't want to be the sole source.
Right.
So again, it comes back to investing. We really saw this as a way to, to leverage and grow. And the doctors have done an incredible job of, and I've seen the results. More people, different projects. It's been fantastic.
And I think when you talk about that seed money as well, it's someone else believes in you, so someone else will believe in you, right? It's that kind of trajectory, right?
Absolutely. I mean, and I think that brings it in. So, with this kind of initial money, we've been able to get other researchers in other fields interested in Parkinson research, and so we've been able to sponsor students in other labs that would have never done Parkinson research. We now have ties into the School of Communications at the university. We have ties in with researchers at Carleton University, obviously Ottawa University, and so it really has greatly increased the diversity of research that we can do and the depth of research. So it is amazing.
And I love how integrated it is to your family. And I know you lost your beautiful mom, but talk to me a little bit about that legacy really that she's left as well.
Yeah, completely, and that's Mom died to be 8 years in July, and she lived a full life. It was it was amazing. My dad was an incredible caregiver. So we often talk about this as there's the patient, but there's the caregiver, and there's the family, and Parkinson's affects all, and that's something we also pay attention to as a group. But the legacy of her mom is great. Like it's sure it's in a different city, but she came down and the doctors would see her as well and take great care of her. And she was really proud. I mean, it took her 50 minutes to complete the 2K walk one year. And we have this great sort of picture of her at the final crossing the line with 50 minutes across the top. It was so we had a great time. It was a wonderful way for her to see the grandkids and to come to Ottawa in May. Beautiful time. Beautiful. Tulips are out having a great time.
We do it well.
And Ottawa shows well. It does. It shows really well. It will come again soon, I hope, because right now it's April. But it's, Mom loved the time and appreciated the family doing this for her.
And I think Andrew's brought up a really good point. And the Ottawa Hospital does this well. And I won't go into my story with my father, but I think when there's that wraparound of, yes, it's the patient, but it's the family, it's the caregivers. I think as a doc, as a researcher, talk to me about how important it is to have that wraparound care.
Yeah, absolutely. And I think that, again, maybe comes back to the model of this integrated Parkinson care is what are the resources that somebody has access to? And again, family is one of those key resources, and what can family do to help, but also other resources in their community that they can access. But it's definitely not just a single person issue. It really ties in the whole family.
And I know you're obviously gunning for a cure, and I think Dr. Grimes would agree. We're gunning for a cure. That's the goal. But even in your time with Piper and seeing obviously the trajectory that Dr. Grimes and his team are on, does it give you hope?
Yes, it really does. I mean, we wouldn't be. Sometimes as a group, we've seen people come and go. We've lost some members, and that's always hard because it's like family. And but throughout that time, we keep coming back to participate because there is hope, and we do see the doctors are growing and evolving, and they're expanding their horizon on where they're looking. And I think what David addressed so well, and one of the reasons that we really felt comfortable from the very beginning was we didn't want to be stuck in a circumstance where David Grimes was doing his research and he didn't talk to Dr. Park and Dr. Park didn't talk to, so the collaboration that this group had, and also you can see, by the way, he was talking about the different hospitals collaborating, the different universities, and then outside of Ottawa, like that is such an important part because we don't want to see research just locked up in someone looking for their own glory, and that made us feel more confident that we were investing in a group that was willing to actually try and get there and make life better for us and our parents.
Do you remember the day you were accepted to medical school?
Unfortunately, that's a long way back. Yeah, I mean, it was definitely an exciting time. I guess I have family ties with the medical field, with my grandfather being a physician, and then my father. And so it's been really one of the neat things I found in my career, that I have patients, and especially early in my career, patients who come and see me and say, "Oh, I knew your father." And My father was a neurologist. He saw Parkinson people, and so that was, something that had happened pretty frequently when I first started in practice. And there'd be the odd person who would say, "Oh, I saw your father," and they'd be a little older. And how long did you see him? "Oh, I saw him 30 years ago." And "Oh no, that was my grandfather. I saw my grandfather." So I was shocked. Just 2 weeks ago, I had a patient come and say, "Oh, I saw your father," and she was in her 90s. "Oh, what'd you see him for?" "Oh, I saw him for my acne when I was a kid." And it was my grandfather. So,
I love that.
Yeah, so it was kind of neat.
Could you have ever imagined on that day where you'd be today?
No, actually, I don't. I really don't. I don't think so. It's been certainly a wonderful journey. It's a privilege to look after people, to interact with families, and it really has been an amazing journey.
What would your mom say about the fact that this is still going strong and the family's still united through Piper?
Yeah, she'd be just proud and happy and great seeing people get together. She was always about the get together. So and I think she herself loved what she saw, and I think the gathering and it's just it's like we have Easter this past weekend, and now we all look forward to the race weekend. It's just another calendar event for family get-togethers.
It's locked into the Frank family calendar.
100%,
I love it.
yeah,
I love it.
yeah.
And when you think about the new campus of the Ottawa Hospital, I mean, we drive by there. I get excited about the parking garage. I know that might seem a bit odd, but it just means that the hospital's coming. And what I know, and I'm obviously no healthcare provider by any stretch, but what I know is that the building is one thing, the people inside are another. Do you get excited about the new hospital from that perspective, of the new talent you can attract, even at this day?
Yeah, absolutely. I mean, it is going to be a wonderful thing for the entire region, and we struggle right now in our clinical research program. We have a lot of things we're trying to do. We're both for developing new diagnostic things for Parkinson's, as well as new treatments, and hopefully, testing the compounds that are going to be the next cure. But we struggle with space. And so trying to do clinical research in an old building, and our coordinators are running around all different places to, we need a -80 freezer, we need this, we need that. We're doing, skin biopsies, and we're trying to do them in the wrong place. And so the new hospital is being designed and built to do clinical research right where the clinical care is happening. And so it's going to be an amazing changeover, and really hopefully get everyone involved in clinical research, because that's really the only way we're really going to move forward with really pushing Parkinson's and improving all aspects of Parkinson's.
Very exciting. I want to send people to support your team. So how can somebody get you to that 2 million? So he has got 2 million. Dr. Grimes has 2 million reasons to smile. How can we support Piper for the upcoming Tamarack Race Weekend?
Yeah, through the Tamarack Race website or through the Ottawa Hospital Foundation, there is the race Run for a Reason, and you can look up partners investing in Parkinson's research. And in fairness, I say this to anybody. I think it's a wonderful thing for anyone who has an interest in getting involved in raising money for the hospital. The foundation does a great job, and the race weekend's a great way to do it. But like any group, we're always looking for. We always talk to the doctors, other people and patients that are interested in getting involved, and a shout out to anybody who's interested in raising money for Parkinson's, because it is affecting, I don't know if it's more and more people, but it sure feels like it, that I know more and more people who's someone in their family, and I certainly have some friends who have been diagnosed, and it's just, we're always looking for people who just want to participate. We always said we want to raise as much money as possible with as little work as possible, and this is, the foundation and the hospital have done provided a wonderful, and thanks to Tamarack for hosting or for sponsoring and being the lead sponsor for the race weekend. It's great.
It's wonderful. We have 30 seconds. What would you say to Piper and through Andrew to Piper for what they've done?
It's just an amazing group of people that really have done an amazing job. I mean, as Andrew said, the seed money has really made it possible for us to go out and get the big grants from. We have multi-million-dollar grants now that started as Piper projects through Google, through Michael J. Fox Foundation, and so that's really. It's an amazing money, and it's an amazing group that we've been able to work with for so many years.
Fantastic. Gentlemen, thank you so much. Inspired me today.
Thank you, Sam. Appreciate your time.
The Ottawa Hospital is just doing incredible things. Thank you so much to Dr. David Grimes and, of course, Andrew Frank for joining us today. When we come back, well, you won't want to go anywhere. My friend Jennifer Van Noort is in studio, and she will inspire you. Stay with us on An Hour to Give. CreatingTomorrow.ca. If you haven't visited, you must do so. Lots of great information there about the Ottawa Hospital and, of course, the Ottawa Hospital Foundation's campaign to raise $500 million. And my friend Jennifer Van Noort is here. She is fantastic. She's a VP at the foundation. She's going to tell us more. Hello, Jennifer. How are you?
Hello, Sam. Great to see you again.
I always forget your official title because I just get so excited to see you. What's your official title?
Chief Development Officer, but you can call me anything you wish.
Well, fantastic. And we're going to call you super successful because you and the team have done a remarkable job. You've raised over $350 million.
Yeah.
When I say that to you, does that sink in or is it still like surreal?
We are humbled and shocked, and it's a big number, $356 million
Yes.
that this community has stood up and rallied around to make possible. So yeah, it humbles us every day, to be sure.
I'm convinced that each and every one of you do not sleep because I see you everywhere, all of you, your whole team has just done a remarkable job. So CreatingTomorrow.ca is all about building a once in a lifetime, a once in a generation building. Now I keep talking about this building, but I love talking about the people side of it. But can we talk about the building for a second?
Yeah.
Because I've learned some really cool stuff recently. So there's going to be 11,000 rooms, meaning all the rooms they need to operate this incredible hospital. And then the patient rooms, 641.
Good memory, Sam.
641
Great job.
Rooms, single rooms.
Yeah.
Okay. So can we talk about those two numbers
bet.
for a second?
You bet.
So 11,000 rooms. I can't even take care of my own bedroom, but you've got 11,000 rooms, and that is going to ensure, and we just heard Dr. Grimes, ensure that researchers have what they need, that the docs, the patients, the environmental team, everybody has what they need, right?
Absolutely.
Yeah.
The planning that has gone into this is absolutely colossal. When you listen to our CEO, Cameron Love, speak, he reminds us that the planning for this new hospital has been 25 years in the making.
Yeah.
So even though our community's not been aggressively talking about it that entire time, the Ottawa Hospital has been planning for this new facility for that long. And you're referencing some of the nuts and bolts. And so, listen, I talk to people every day. I have that privilege where we speak about what the patient experience will be like, what the medical staff experience will be like, and what the visitor experience will be like. And so when you think about that 640 rooms, what a game changer that is to have a single room for every patient, a single bathroom. You think about the technology that will be in each of those rooms. We are the largest teaching hospital in the country, and so how incredible that you've got multiple caregivers, so they'll be able to communicate with the electronic devices. The floor-to-ceiling light is something that our staff continue to talk about, and the space in the room. Right now, you can be sharing a room with multiple patients, and our medical staff can't always get around the way that they need to.
Right.
They're best in class, but to think about the space, the bright light, the technology, and what that will mean, and how amazing that there'll be room for a loved one to stay with you. That I speak with many families, and they're just so grateful for that opportunity to have a loved one. And when you talk about the 11,000 rooms and all of the nuts and bolts and this massive facility, we have involved the staff and the patients. The staff and the patients to make sure that we get it right, and so their voice is heard there. And how is it the best facility that they need?
And I really do believe 100 years ago, when that original civic campus was built, that they got it right. But technology and times have changed, so we need to get it right in this generation, right, Jen?
We absolutely
Yeah.
do. And I think this is where I get really excited, but I find that statement a bit sobering because I get it. Right now, the economy can be considered quite volatile. We're debating tariffs. We've got political debates going on. But the reality is, 100 years ago, our community did pay it forward. And the reality is, the next cancer diagnosis that's going to take place today can't wait until the economy settles down.
Yeah.
And the next patient who needs a life-saving surgery can't wait. And the next patient with an opportunity to go in a clinical trial can't wait. Our community, I am reminded every day, needs us to keep pushing, needs us to push forward for this incredible building, and needs us to really focus beyond the building, actually, on reshaping the future of healthcare and paying it forward, like 3 generations ago did.
And here's what's great, and I'm so blessed. I've had the opportunity to speak with many, many donors to this campaign that have given $1 million gifts, right? Because of my role here, obviously, on Rogers and other roles I have in the community. But what I love about Tamarack Race Weekend is that everybody can be part of this campaign. I really do envision, I get so emotional thinking about it. I envision 1 million people in this community, each of us saying, I did something, I did something. Whether it be $25, 25 million, and everything in between. They can do it that weekend,
I
right?
love that.
Yeah.
I love that. And
Yeah.
so I'd be remiss not to say thank you, Sam,
Yeah.
because not only are you one of our biggest cheerleaders, you're also one of the first individuals to step up and support the campaign. But you're right. It is there. What we say is there is a place in this campaign for every single donor. Help in any way you can, because you or your loved one may need to call upon the Ottawa Hospital, and we want to be there. The race weekend is it gives me shivers just thinking about it, one of the most powerful events for our entire city. It galvanizes the entire community, and everyone can get involved. 2K, 5K, 10K, marathon, half marathon. You just heard from the Piper team. Be a part of giving back and doing your part. Have fun and get healthy.
Right.
And also be a part of history and what Race Weekend represents for this campaign.
And I'm hearing Dr. Quadrocure-Mentang say preventative over prescription,
bet,
right?
you
So you're
bet.
going to get out there and be active. One of your greatest doctors, of course, in the ICU, part of your campaign team. And, I hear him go, get active, and therefore you won't be in my ICU, right? So
Yeah.
he's always talking about that. But I think this is an opportunity for each and every one of us to also get our kids involved.
Yeah, for
You
sure.
know how important that was for me, Jen, for my kid to know that whether it's 10 years from now, 20 years from now, if she finds herself, at the Ottawa Hospital, at that campus, that she walks in those doors, she's getting cared for, and she's like, our family contributed. I want every family to feel that way. I
Yeah.
really do.
This campaign has that really lovely feel, doesn't it? This real legacy, this real family building feel where everyone can be a part of that. And you referenced Dr. Kerry Mantang. I mean, he's just, again, one of our biggest cheerleaders, joined as one of our co-chairs of the campaign, along with Kevin Ford and Ginger Bertrand. And, it's just been, it's been so exciting to see that take shape. It's amazing.
And I think, too, when we think about the race weekend, May 24th, 25th, circled on my calendar for sure. When I think about that weekend, there is such a vibe in the city. And adding the philanthropic piece on top, and we've talked about philanthropy before, time, talent, and treasure. This allows you to do all three, whether you can get out there and race or walk or run or do whatever you're doing. You could also donate. So if you've got a neighbor that is participating, you can participate by the gift of treasure.
Yeah, for sure. I love that. And listen, I might get in trouble if I didn't mention Jeff Clark as well as one of our other amazing co-chairs as well. And you're right, there's just so many ways for this one weekend, May 24th and 25th, to just lean in. And whether that's making a donation or supporting a participant or joining a team, rallying. We've got some great teams. Team Ashbury that's had an army for many years that's gotten involved. We've got an amazing team, next generation team that's looking at getting the next generation involved. And I love that they're figuring out their flavor, their way to lean in on this campaign, and or just support another runner or another fundraiser, because that is the real connect the dots then, right? That, to healthcare and to philanthropy.
And could this city be more gorgeous in the month of May? So you're going to be able to, to enjoy the city, give back a little bit, and of course give back to the Ottawa Hospital.
Yeah.
I just can't envision any other team taking on what you've all taken on. It really led by Tim Kluk, led by yourself. Like there's some really core people that are involved, and I just picture you as matchmakers all over the city all day long, just sharing this really important message of philanthropy for the Ottawa Hospital. Talk to me a little bit about the team. How are you all doing this?
It's a really special team, Sam, and you're very kind to share that. And you and I share that passion for philanthropy in general. And we've got such an incredible community here with so many worthy charities. Our team at the hospital is committed beyond words because we know this is our hospital, and we know what this campaign means for our families, for our colleagues, every minute of every day. You just heard Dr. Grimes speak. So every minute of every day, I mean it when I say we are inspired because we're listening to one of our medical colleagues talk. We're watching them, we're witnessing their commitment. We're talking to courageous patients who just say, I'm gonna put my life in your hands, and I know that I am in the best possible hands, and so we're going to keep pushing. That's the joy that our colleagues have, and the real privilege. We feel like we're making history, and we're going to keep pushing.
And you are. You are making history.
Yeah.
Do you remember the first time someone said to you, maybe it was Cameron Love, maybe it was Tim Kluk, listen, Jennifer, we need $500 million. Do you remember that moment and thinking, how are we going to do this? Or were you the Jennifer Van Noort that I know and you just immediately went, we can do this?
It's a daunting number. We are asking our community to do a lot and consider a lot. But it's the right number, and we believe with the support of the community that we can do it. And we know fundamentally that big numbers like that, big visions like that, inspire incredible philanthropy. So it needs to be that number. And when you're building a hospital in the province of Ontario, there is a local share component, and our campaign is a critical piece of that. So we don't apologize for that. We own that. It's a big number. The community is rallying around that. Some would argue we've still got, though, one of the biggest campaigns in the city to go, and that's the back end of this campaign. So we can't let off the gas. But is it daunting? Yes, but it's the right number.
Amazing, amazing. I could listen to you all day long,
Right
honestly.
back at
We're going to come back with Jennifer Van Noort, of course, from the Ottawa Hospital, creatingtomorrow.ca. You'll want to head there. We're going to learn more about the foundation. Stay with us on An Hour to Give. Dave? Well, if you're like me, you wish that you could bottle the enthusiasm and the inspiration of the one and only Jennifer Van Noort from the Ottawa Hospital Foundation. The way she speaks about the $500 million campaign to create a brand new campus for you and me, your family members, for everybody in this community, it is inspiring, my friend.
Love it.
You do inspire.
Oh, thank you for saying that, Sam.
It's
Thank
true.
you. It's very kind.
And I'll be honest with you, thank heavens I don't call you every time I drive by the new campus, because I'd be calling you all the time.
Right.
Because I'm always checking it out.
Yeah.
So right now, all we see is the parking garage so far.
Yeah.
But that's an important part.
You bet.
So the parking garage is there. But we know that you couldn't wait to raise all the money and then start to build.
That's right.
So these are being done in parallel.
That's right.
I think it is interesting for people that aren't as close to the project as you are to kind of understand the process a little bit. Walk us through it.
Yeah, how wonderful that we didn't need to wait until the end, and so that there is some wonderful progress to share. The wonderful part about starting with the parking garage is that there are going to be 2,000 to 3,000 construction workers on site building that incredible new hospital facility. And so we needed somewhere for all of those
Right.
construction workers to park. And so there's method to the madness in that regard. And so it is happening in phases. And so right now the parking garage is about halfway done. It'll be done at the end of this year. And then the hope is that the shovel will go in the ground next year for the main building. The planning, the design plans are halfway done, expected to be done at the end of this year. Again, that incredible process involving all of the different divisions and departments and patients and family groups to make sure that we get those design plans exactly right. Truckloads of dirt from the site. It was such a beehive of activity. It is happening. And so that is really exciting that when I get to speak with individuals in the community and I say, this hospital is going to become a reality, they can see that. When you drive by that site, you can see the progress. We have an incredible video, if you visit our website, that shows the construction progress that we've had over the last 2 years. It's amazing. It's humbling and amazing, and you've got to see how far we've come.
And such a great location, right? I mean, it's fantastic. I'm so excited. And of course, I love the healthcare aspect. That's why we're talking about it today. But the economic boom is nothing to sort of sneeze at. That's something that's really important too for our city.
Yeah.
I love the people that have gotten involved and backed this program.
Yeah.
I had the opportunity the other day to be chatting with some people about this project. And, it's people in our community that are business leaders.
Yeah.
It could be a small business. It could be a multi-million-dollar business, but each and every one of them knows it's important to attract their own talent, aside from the talent at the hospital,
Right.
but to attract people to live the quality of life we have here.
Yeah.
This new campus is just another notch of
Absolutely.
incredible healthcare opportunities in our city.
I agree, and I think that's what a lot of the community and business leaders are sharing with us, that every great city would have a pillar in healthcare like this, right? Of course, you need the arts and social services and everything else that makes a great city great. But I think there is a real sense of pride right now that not only do we have many of the best-in-class researchers in the country and medical staff in the country, but that this new facility and our vision around reshaping healthcare is attracting among the best. They are choosing to come here because this is what this city is putting first. We want healthcare to be best in class in every sense. And I appreciate your comment about saying you like the site as well. I have fallen in love with the site and what that's going to represent, this real hub for the city. And from an economic point of view, there is no shortage to the industries and sectors that this is going to reverberate and help in that regard. And I think as we look at some of the community and business leaders leaning in, it's because they're seeing that at the heart, having a best-in-class hospital like the Ottawa Hospital and our new vision is what that's going to mean for staff and clients and families. And so excited to see from an economic point of view the billions of dollars that this will represent.
We're going to test my memory.
Okay.
So I think, you can correct me.
You bet.
Is it 2 million square feet?
2 million square feet.
Okay.
Yes.
So anyone that's ever built a house,
Right.
like 3,000 square foot house, and you're picking
Yeah.
all of the, the hardware and the colors and all of that,
Yeah.
that kind of care and attention has gone into 2 million square feet. And that's for each and every one of our families and for
Absolutely.
us, that
And then
kind of care.
You layer on safety beyond
course.
that, and the patient experience beyond that, and
Technology.
technology, right? It really is just such a complex project with patients at the heart. I go back. It's what is this going to mean for every patient that we have today, and for every patient that we will see in the future? And that's why research is such a pillar of what we're doing, and what Dr. Grimes would have touched on as well. We're looking ahead. We need to look ahead for what are the needs for the community right now, but what are the needs going to be in a generation from now and a generation from then?
100%. Can we talk about research for a
bet.
second? Because when I heard, I heard the rumblings, there was going to be this big campaign for the Ottawa Hospital. And when I saw it first laid out, I'm testing my memory again, 2022, I would have learned.
We launched in 2022. You're good.
So 2022, and the fact that it dovetailed this campus and research,
Yeah.
I thought was the most forward thinking.
Yeah.
Because you're also attracting the world-class, you've got world-class researchers now, but we know how important, we don't have to talk about the times we're in, to keep attracting people to Canada, keep attracting people to Ottawa.
Yeah.
So that research piece was really important. But then for the facility and the institution to be as well fully technical, fully fitted to ensure that all of that was going to happen in that building.
100%. And I would say we do not exist without research. So research is care. Our Dr. Rebecca Auer, who heads up our entire research institute, reminds us of that. And our team is completely dedicated to what that game changer means, the
Right.
access to medical research. So it is absolutely a pillar of everything that we do. I have to share this, Sam, that
Yes.
I am thinking a lot about a beautiful young lady right now, Chantel is her name, diagnosed with Parkinson's disease at 37.
Wow.
This is where you see care and research collide in such a powerful way. And she says, I may not see a cure for Parkinson's in my lifetime, but I have the gift to participate in research, and I know that they're going to find a cure. And when they do, I want to say that I was a part of that. I think about Chantel. I think about what research means in terms of hope for her and her family and the millions of patients that look to the Ottawa Hospital. That cannot exist without research being one of our absolute pillars. That makes me really emotional and even more fired up because they really are one and the same. And I think it's what makes us awfully proud about what this new facility will mean and what this campaign represents. Care and research together.
I mean, visiting creatingtomorrow.ca, you can make a gift. Even hearing that story. If someone doesn't have a story of their own, take Chantel as their story.
You bet.
Right? Because there's so many of those stories.
Oh my goodness. Please take a
Yeah.
moment. Honestly, I would
Yeah.
encourage folks to visit because we have so many powerful stories that really push us, they inspire us, and they remind us that at any moment when you do receive a diagnosis, you want to know who's there to support you. And the Ottawa Hospital, that's what this campaign is all about. But the stories that we share are pretty powerful. I look at them often.
are.
I know our team does as well.
They are. And, you know, when I think about the Tamarack Race Weekend coming up May 24th, 25th, so not that far
No,
from now,
right around the corner.
that the whole city will come
You
alive
bet.
that weekend and be able to really, really cement how the community feels about the hospital.
Yeah.
That weekend, what do you do that weekend?
Yeah.
What's that weekend like for you?
I will be among the thousands and thousands of fans that descend on the city, and I will probably not be running. I used to do that, but I will be there to cheer on our runners, to cheer on our fundraisers, to be a part of that magic. You know, I have said for many years, philanthropy should be joyful.
Yes.
You're doing it wrong if it's not joyful.
True.
And so how great to be a part of Race Weekend and just see that that buzz and that energy. That's where you'll find me, and that's where you'll find many.
Yeah, and just hearing about Piper, we met Andrew Frank, of course, earlier, and Dr. Grimes talking about the impact for Parkinson's that weekend. I mean, there's just so much that happens for that weekend.
Yeah.
How would you inspire someone that maybe has never given a gift before to the Ottawa Hospital? Maybe they've never been to the Ottawa Hospital. There's a lot of new Canadians, people move to Ottawa for various reasons. It may not feel like their hospital yet. Yet.
I love that.
How can we inspire them today?
That's an amazing question, I would say. And so I would say the beauty is, can we have a conversation? So the best thing that you can do is to have a conversation, visit the website, listen, read the stories, think about what it would mean to have that facility in our community. Think about generations from now. Again, if you go back that 100 years when that existing Civic was built, it's that same message. Someday we may look to the hospital and need it. And so we want to make sure that it's there in every possible capacity. And again, it doesn't matter about what you give, it's that you give. I love when some of the folks that I speak with as well say, well, what have you done? Or what has the community done? And I'm able to say so proudly, join me in giving, join Sam in giving, join our senior leadership team and our boards and our foundation team who have given 100%. We've gone first. We've gone first. So join me in a conversation.
And then I have a new goal. So, and you inspired me the other day. We were hanging out the other day with a bunch of amazing people, and you inspired me the other day. I want to tell 5 people. So I've given myself the next 30 days. I want to tell 5 people, and I think a lot of people say, "Oh, I don't want to tell people that I gave because it feels like you're braggy." But I don't want to. That's not why I want to tell people. I want to tell people because I want people to know that a single mom living in Richmond can donate. It doesn't mean it's $1 million, but it's meaningful for my family.
So that makes me very emotional because that's the point, isn't it? Gifts of equal sacrifice, everyone can do their part, and unbelievable things can happen. That's the power of philanthropy.
But can you imagine, like, if everybody just felt like it was part of their budget, and the next, even if to give a gift over 5 years. Like, I had somebody come up to me after we were together the other day, and they said, "How did you do your gift?" And I said, "I originally was going to do it over 5 years, and then my credit card got compromised, and I just did it. I just did it all." But there's so many different ways. A conversation is where it needs to start.
You bet. Yeah, that's exactly how it starts. And yes, pledge it. That's the beauty, right? You can pledge it over multiple years.
We could talk for a day and a half.
I know we could.
Yes,
Thank
we
you,
could.
Sam.
Jennifer Van Noort, what a sweetheart. What an angel in our city helping to raise money, along with so many others at the Ottawa Hospital Foundation. I hope we've inspired you today. Visit creatingtomorrow.ca. Participate in the Tamarack Race Weekend. Get your run on, all for the Ottawa Hospital. I'm Sam Laprade, and this has been An Hour to Give.